Hello friends, now we will talk about the SIQORAAA. SIQORAAA is just a mnemonic. It's used mostly by many of our students like so who give the examination. SIQORAAA is nothing, just a mnemonic, and its full form is S for sight, I for intensity, Q for quality, O for onset. In that we also add the duration and the progress, and O, and then R for radiation, and A for aggravating factor, another A for alleviating factor, and the last A for the associated symptom, in which we include the nausea, vomiting, diarrhea, cough, chest pain, dyspnea, fever, appetite pain in the abdomen. So you will see that we'll cover majority of the question in the SIQORAAA of the history part, and so if we miss out any question also, then as per this mnemonic and the associated symptom we had made, we could easily point to that question. And so now let's start. The first question will be about the sight. So sight will be like that can you tell me exactly where you have the pain? The patient will reply accordingly, and you just write it down. But I will prefer that you just ask 2 to 3 questions together, and then ask the patient that can I write it down, and then write it down, so it makes a good rapport with the patient. Now the next thing in SIQORAAA comes the I. I stand for intensity. So intensity question will be like on a scale of 1:10, where 10 is the worst pain you ever had, can you grade your pain, or how will you rate this pain? So this became the question for the intensity. Then comes the quality. Quality Q for quality. Quality will be like could you please describe your pain? So see, you here it becomes an open-ended question also, so you get marks for the open-ended question also in this, like could you describe the quality of the pain, or could you describe the pain? That's it. Now come the onset, and as I told that we should include the duration and progress. So onset, so since how long you have the pain, and for duration, so how long the pain lasts, and the progress. So for the progress we can ask how has the pain progress, whether it's increased or decreased. You can give the option later on if the patient asks you, then say that whether your pain has increased or decreased, or has it changed. That about the radiation, like can consider
Does the pain move anywhere? Aggravating factor. Does anything make your pain worse? Alleviating factor. Does anything make your pain better? The patient might reply yes or no. Then you have to ask that what makes it better or what makes it worse first. And if it's no, then it's no. So you can ask 2 to 3 questions at a time, and then just tell the patient that can I write it down, and just write it down the positive points. Now about the associated symptom, this will cover the majority of the questions, majority of the negative history also will come in there. Will come in this. So the associated symptom I have made in 3 parts. It consists of 3 questions in each part. So total are 9 questions. First part consists of nausea, vomiting, and diarrhea. So we will like to ask the question like, do you have nausea? The patient will reply. Vomiting. Again the patient will reply, or any change in the bowel habit. The questions will not be asked like this, do you have nausea, vomiting, diarrhea? You have to ask each of it singly, like do you have nausea? The patient will reply, no, I don't have. Then you have to say then vomiting, okay, and do you have any change in the bowel habit? The patient will reply accordingly. So the second part consists of cough, chest pain, and dyspnea. Dyspnea is a medical term, so we can't use that. So we will ask like, do you have cough? Patient will reply. Then do you have chest pain or pain in the chest? Okay. And about the dyspnea, do you have any difficulty in breathing? So patient can reply accordingly, and now you can say that can I write it down, and you can write down the positive point. And if you find any positive point like the chest pain, then you have to go deep into the chest pain, asking about all the SIQORAAA question which we discussed.
So, and please remember, if a patient say anything yes, then just don't shift onto the another question, because patient wants you to ask deep into who the positive history which he has already given you. Next part the third part consists of fever, appetite, and pain in the abdomen. So, do you have fever? If the patient says yes, then you have to ask all the questions regarding the fever, how much fever, intermittent or progressive, or at what time of the day does it come, is it relieved by any medication, and all such questions. And about appetite, how is your appetite? And pain in the abdomen, if that is not your main complaint, that do you have any pain in the abdomen, like this. So this becomes your associated symptom, and you can then summarize all the associated question which you have asked and summarize back to the patient. Like so, as you told me, you don't have any nausea, vomiting, or any change in the bowel habit. It also you don't have any cough or pain in the chest or difficulty breathing. Along with that, there is no fever, or your appetite is normal, and your appetite is normal, and there is no pain in the abdomen. Am I right? The patient will reply. So this becomes your paraphrase also.